And thank you very much to everyone who is present today. Thank you to all participants. Thank you for your time. Thank you for your effort in joining our class today. Okay, I know Dr. Pamela has covered, right, the basic foundation of listening skills and also the first part of handling trauma, crisis, and grief. But today, I'm also going to talk about, but it's the part two of handling trauma, crisis, and grief. And I'm going to be very specific in this, right, in terms of focusing on one particular part that connects crisis, trauma, and also grief. Okay. Actually, there's a video. If you see this man in front, on the screen, it actually shows like, since it's not moving, I'm just going to tell you actually what he's actually doing. So it's actually, sometimes he'll be smiling, sometimes he would shed a tear, and sometimes he would be, just staring in space. Okay, that's basically what he was doing. Okay, so basically it's actually a sign, a sign of a person that could be going through specific traumatic experience or crisis or actually grief. Okay, so let me start by okay. So before I talk about the mental health spectrum, okay, I would like to ask everyone, if possible, all right, to take note, right? So if there's anything that I would say or I talk about today would trigger all of you, or some of you, I would like you to take a breather. That's one. Okay, take a breather. You can leave for a while and come back later if you feel triggered at any point in time during my presentation. Okay, and then you can also do some breathing exercises like what Dr. Pamela has taught all of us. All right, and do some grounding technique as well, and also talk to someone if you feel a little bit uncomfortable or anything like that during my session. All right, so just a little bit of trigger warning. Okay, so can I ask all of you to tell me if you can give me a number, right? You can give me a number. What would be the number of, what would be your mental health for today or this morning? Can you give me a number and type in the chat box? It can be from 1 to 10. 1 is not really okay. 1 to 4 is not really okay. 5 is just, so-so, and 6, 7, 8, and 9, and 10, of course, would be in a good state of mental health. Okay, thank you for the numbers. 6, 8, 8, 7. I can see 5, 7, 9. Very good. Okay, 8, 5. All right. Walaikum salam. All right, 6. Okay, 8. 7, 10. Alhamdulillah, 10. 9. Okay, very good. Okay, thank you so much for telling me your mental health, or how you feel this morning, because that would actually indicate, how do we start our morning, for example, and how would actually it affect us for the whole day. Okay, so we should see, or we can see mental health in a spectrum. So as you can see on the slides, right? Mental well-being, that's the very good state of well-being. It means that you are emotionally stable, you are resilient, and then you have a clear sense of purpose, and you can actually function very, very, very well. Okay, so that is the state of well-being that we would like to achieve. Okay, but sometimes there are certain moments where we actually have some crisis or some difficulties or challenges in life. So we can actually go from a good mental well-being to mental health issues. Now, I would like to emphasize here that there are differences between mental health issue and also mental illness. Okay, mental health issues, it can be any individual that may experience mild to moderate mental health challenges. Like I said before, everyone is susceptible to stress, anxiety or crisis or mood fluctuation. So it's very, very normal. Okay, I'll give you an example. If we lose someone that we really care about, or that we love, it is very normal for the person to go through grief, or it could be a traumatic experience for that person, right? And also, he or she could go to a state of crisis as well. So it's very normal. But how do we know that, or how do we know the signs of whether it is becoming a mental illness or it stays in mental health issues? So we need some intervention immediately when the person actually reaches the mental health issue, or when the person actually go through certain crisis or trauma or grief. Intervention should be done immediately so that you won't go to the end of the spectrum, which is mental illness. Okay, because when it reaches mental illness, the symptoms or the signs or the condition of the person might be very, very severe. So that is where a clinical psychologist will actually diagnose a person would be having major depressive disorder or depression or anxiety disorder, schizophrenia, and other psychiatric disorders. Okay, and that would mean they cannot function properly. Okay, so this would need intervention, as well, immediately, because again, the more that you leave a person without any help or support or intervention, the more the symptoms will become worse. So that's why mental illness, people who have mental illness or diagnosed clinically with mental illness, they would need combination of pharmacological, drugs or medication, and also psychotherapy. Okay, so that is the difference between mental health issues and mental illness. I'm going to add one more under mental health issues. So how do we know if the person is actually going through certain depressive symptoms only, or it has become depression? So one of the markers or indication is if the person has been experiencing anxiety symptoms or depressive symptoms for more than 2 weeks. Now, it is stated in DSM-5, Diagnostic Statistical Manual, that we use clinical psychologists use to diagnose and assess, right? So we do that. If we see a person, having those symptoms more than 2 weeks, then that would be an indication that it is becoming more severe. So that is why we need to know this spectrum. It's a spectrum. Okay, I hope that is clear. So moving on. All right. So what's the connection between crisis, trauma, grief, and suicide? So this is where I would come into this particular section where there is an intersection or interconnectedness between trauma, crisis, grief, and also suicide. So as you can see there, if a person is going through crisis, trauma, or prolonged grief, it can intensify the emotional pain, which could, I'm emphasizing on the word could. Not everyone is actually going to commit suicide, but it would lead to suicidal thoughts. Okay, so we're not actually looking at the act of committing suicide first, but we are looking first at the suicidal thoughts. So because it all starts with suicidal thoughts, and then you have precipitating factors. Precipitate here means the trigger. Okay, so a crisis or trauma can be a trigger for a person to attempt not to commit suicide. Okay, they will be at higher risk if they already have mental health issues, as I mentioned earlier on in the spectrum. So if the person is actually going through something, it can be heightened or they can be triggered, very much if they are in that particular phase. And then, of course, losing someone, as I mentioned before, okay, or losing a loved one through suicide can actually create grief and trauma cycle within the family itself. So it's not only the person that is affected, the person who attempted to commit suicide. It's not the only person who will be affected. It's also the family and also the community. So that's why aftermath is there. Okay, so I'm trying to connect what Dr. Camelia has covered in the last session. So this is where I come in when I focus more about suicide. Okay, this is something that is very close to my heart. Not suicide, but suicide prevention. Okay, all right. So what does the term suicide mean to you? Can I ask everyone? Can I see in the chat box? when you hear the word suicide, what comes into mind first? What was the first thing that comes into mind? Taking your own life, correct? Loss of hope. Thank you. And the pain, hopelessness. Yes. Feeling there's no way out of problems, lack of purpose. Yeah, that's very true. Okay. Anyone else? Ability of one to take his own life through hopeless. Yes. Hopelessness. Depression. No purpose in life anymore. To end life problem. Yeah. True. Okay. Thank you so much for the responses. Okay. Take your own life. Correct. So all your answers are correct. So let's see what does it mean actually by suicide. So let's look at the statistics right now. World Health Organization has mentioned, yeah, more than 720,000 people die due to suicide every year. Okay, and this is a very how to say grieving issue, and also it's a public concern. Okay, suicide is the third leading cause of death among 15 to 29-year-olds. Okay, can you imagine? From a very young age, people are already exposed or already having suicidal ideation or symptoms, in terms of the mental health. So working with suicide risk, it says here, is an inherently unpredictable endeavor. So what do I mean by that is you can never predict when exactly a person can actually commit or attempt to commit suicide. Yeah, in our profession as a clinical psychologist or a counselor, you can never really predict whether our patient or the client that we see today is actually still going to be alive tomorrow, especially when they are in high risk. Okay, so it's very, very important to learn how to prevent that from happening. Okay, so even, for example, if I see my client today, it doesn't guarantee that she will be with me tomorrow. Okay, she can be going back from my session, okay, but after that, nauzubillah, yeah, I would hear, she has taken her life or has taken his life, so we can never predict, yeah, when a person can actually do that, right? So later on, we will learn on how to prevent it to become like that. Okay, so the World Health Organization defines suicide simply as suicide is the act of deliberately killing oneself. And as I mentioned the last point there, suicide itself is not a single process of deciding to end one's life with subsequent action. So what does it mean? It means that nobody wakes up in the morning. Nobody in a sane mind would actually wake up in the morning and say that I want to commit suicide today, or I wanted to attempt suicide today. Nobody in a sane mind, like I said, would ever do that or would ever think of that. Okay? But it is actually an accumulated stress, accumulated anxiety, accumulated depressive symptoms. So they have been actually struggling for a very long time. And it has come to a point that they think, what you mentioned in the chat box just now, they think that it is hopeless and is helpless. They just want to end the pain. Right? So that's why that's the only thing that they manage to think of, because they're not actually in the good state of mind. And people, yeah, would present or manifest all these symptoms in different ways, which we will cover later on in details. All right. Okay. So let me ask some questions about suicide. So whether it's a myth, you tell me. Can you tell me whether it's a myth or fact? Is that okay? Is that okay? Everyone? Okay. All right. Asking about suicide will plant an idea in a person's head. Is that a myth or is it a fact? Is it a myth or is it a fact? Can I see in the chat box? It's a fact. It's a myth. It's a fact. It's a fact. It's a fact. It's a myth. Okay, fact. All right. Okay. It's a fact. It's a fact. All right. It's a fact. It's a myth. So it's a combination of answers, right? Okay. Asking about suicide will plant the idea in a person's head. All right. So if I'm showing symptoms, for example, if I'm showing symptoms of depression or anxiety or anything like that, you asking me whether I would have or it ever crossed my mind, if I say yes, would that make me wanting to commit? Okay? So by you asking me, right, a question like, are you planning to commit suicide or attempt suicide? Would that plant an idea in my head? Actually, it is a myth. Okay, why is it a myth? It's because when people, okay, suicide is I think it's still a taboo thing to talk about, isn't it? Right? It's still something that we don't really, wanting to discuss or confront because it's a very sensitive issue. Okay, but if you see someone showing signs, like I said before, if you see me showing signs of depression or anxiety, that means I am already in the state that I'm not in a good state, right? So if you ask me whether it has ever crossed my mind, it won't actually plant an idea in my head. It's actually you allowing me to talk about what I really feel inside. Okay, being able for someone to actually ask me is actually not going to plant the idea. Okay, you are actually allowing me to be vulnerable because not everyone is comfortable to talking to someone and tell them, you know what, it has crossed my mind, because we fear judgment. Okay, and people are very much, actually, I'm sorry to say this, but yeah, some people are very judgy in terms of, okay, don't talk about suicide, we don't want to talk about it because it's something that is haram or anything like that. Okay, but actually asking them whether it's ever crossed their mind is actually a good thing. Okay, you are actually asking, okay, whether there is a next action plan after that. So this is what we would learn later on in the slides. Yeah, so it is a myth. Okay, remember that it's a myth. Actually, if you ask someone, it's not going to, let the person, to commit suicide. It's actually you allowing them to be vulnerable and saying the truth. Okay, all right. So next one, if somebody really wants to die by suicide, there is nothing you can do about it. Yes, is it a fact or is it a myth? Can I see some answers? It's a myth. It's a myth. Correct. Yes, very good. Yeah. If somebody wants to die by suicide, you have not, you can't do anything about it. Actually, you can. It is a myth. All right. Of course, the outcome. Nobody, like I said before, nobody is ever sure to of the outcome, but you can actually intervene. That is the most important part. The things that you can do for them is to actually intervene by being empathetic, by asking questions. Later on, we will also learn on how to ask, questions that could help you to decide on what to do or how to help them. Okay, so you don't need a degree to actually help another person or to intervene by giving by being there, by being present, by listening to them, as what Dr. Camilla has mentioned before. Just by listening to them is actually a very very good help. Okay, because they know that you are going to be there when they need you. Okay, and that is the least thing that you can actually do. All right, so you can do something about it. Okay, then I think the last one. Yeah, so he or she really wouldn't commit suicide because he just made plans for a vacation. She has young children at home. He made a verbal or written promises. She knows how dearly her family loves her. So what do you think? Do you think these people actually can commit suicide or would commit suicide? Okay, somebody said just now, because in the core people want to live. Correct. So what about this one? Do you think these people would want to commit suicide? Possible, yes. It's a myth. Yeah. Actually, yes, this is also a myth. Yeah. Why did I say it's a myth? It's because not necessarily that I've made plans, for example, to go for a vacation, or just because I have children at home waiting for me, or just because, I made a verbal or written promises, just because, I know somebody loves me, it doesn't mean that they actually cannot commit suicide. They can actually. They could. Okay, they could commit suicide as well. So that's why I said it is something that is very unexpected. Even people, yeah, who died of suicide, they would say, what if they leave, like will or letters, I know I've been loved, for example, in their, in the letter, they would write, I know I've been loved, but it's, I cannot take it anymore. Okay, it doesn't mean that if they have responsibilities here, it doesn't mean that they could not or would not commit. Yeah. Okay, so this is also a myth. Right, and thank you for participating. Okay. Now moving on. Our duty as a helper. So why is it important to intervene? Because we have this duty to be a helper. And it's very much in line with one of the objectives of Maqasid Sharia. And also it is highlighted in this verse. Whoever saves one life, it is as if he has saved all the humanity. Okay, and I think it's a very important reminder to all of us as well. And whoever relieves a believer's distress, Allah will relieve one of his distresses on the day of resurrection. This is how much we encourage people to support one another, especially when the person is in distress. So, like I said before, you don't need a degree or any certificate to actually be a helper. A helper here means, in this context, is actually your ability to actively listen to this person, allowing them to be vulnerable, allowing them, give them a safe space. Okay, and we as an ummah, right, a society or part of the society, we are actually responsible to take care of, the people, that we have, the people in our community, so that we have a good mental well-being. Okay, and also I would like to highlight here, you can be an agent, of Allah's mercy by helping other people to navigate the struggles. So if we look at the concept being a vessel, for example, so it highlights it's not only that you are living your life according to what you need and what you want and what is your purpose, but also connecting to other people, helping other people is also your higher purpose. The connectedness or interconnectedness that we feel with other people is also a purpose. Now, it also emphasizes humility, as I highlighted there. Yeah, it emphasizes humility and belief that we are actually doing good, with each other. By doing good with each other, Allah is going to have mercy on us. Okay, and acting as a conduit for kindness and support, it benefits not only mentally, physically, but also our spiritual journey. It can aid our spiritual journey. And it says that it reflects a reciprocal cycle. So aiding others and being aided by others in return. So actually, kindness is very contagious. Okay, kindness is very contagious. So if you see someone doing kindness to another person, the other person might be inspired to do good or to be kind to another person as well. So not only it fosters gratitude, it reminds us of our role, okay, that we are a part of a bigger plan, not only for ourselves, but also for other people. All right? Okay. So this is actually adapted from the Department of Veteran Affairs. They have used this approach to actually prevent suicide. Okay. So I came up with this very, I think, similar approach. It means S, seek to understand; A, ask with empathy; V, validate and provide hope; and E, encourage and also support. Okay, let's see the breakdown of SAVE. Okay, so it says there, right? Providing a safe, non-judgmental space, actively listening and observing and recognizing the signs of emotional distress reflects a sense or compassionate care to other people. It means that you are aware of the person, what the person is going through. And also, again, I've mentioned this earlier on, it's a part of our duty to preserve life. Okay, and then it says there, it has been mentioned, right? It has been mentioned in many different surahs how important it is to provide, this safe space for people and for us to not be judgmental of what they are going through. By lending your ears, observing carefully, recognizing the sign, being aware, being mindful of what other people are going through is very important. So that's why S is to seek to understand what is the person going through at that particular moment. All right, that is S. Moving on. Okay, asking with empathy. Now, this is very important. I think Dr. Pamela has mentioned this many, many times in her lecture or in her session. We need to demonstrate adab, right, proper conduct, and also rahmah. Whenever we speak or whenever we ask questions, it needs to be what the core has. It has to be empathetic or empathic. Okay, when the way that we ask question, the way that we seek clarification, we need to ask gently and directly about the struggles and thoughts, because sometimes I think our niyat or our purpose is very, very good, very true. However, the way it comes out or the way that we say it actually does not match our intention. What do I mean by that? Sometimes we say things without being mindful, for example. All right, so that's why it has to be proper. So I am going to talk about what will be, the what would be a gentler way to ask questions later on when you want to ask specifically about suicide. Okay, moving on, the V. Now, validate is very much a part of empathy as well. Acknowledge the individual's pain while reassuring them of Allah's mercy and the possibility of ease after hardship. Now, sometimes, I'll give an example why I highlighted the word possibility. Because again, there's no guarantee. Because sometimes clients ask me this question, when would the pain stop? All right, and that is a very difficult question to answer. Because nobody knows, how long the person will be in that particular state. And I don't have the answers for that as well. Okay, so there is a possibility of ease. We reassure them. Okay, we assure them through validating whatever that they're going through. Okay, validate here means, again, listen actively, respond empathetically, right? And then make sure that you actually are present, right, with them. You're constantly, being able to see how they process their emotions and all that. So through that would give them hope. Okay, and I've listened to one lecture, and then this famous psychotherapist would say, my clients would come to me actually with this little amount of hope. And then she said, you know what? You can borrow my hope until you get yours. That is how we are hopeful with our clients. Okay, we do want to feel that they would be eased, inshallah, after that hardship. And the last one, of course, E stands for encourage, help, and support. So it's part, of our responsibility, as a community. Okay, so Allah really, really loves people who actually think about how to make society better, or how to think about how to strategize, better to make the lives of people, better. So all that will be our part. So encourage them to seek professional help as well as spiritual support. Okay, while offering, what will be the practical help is you being there again. I'm mentioning this again and again. You don't have to, actually have a degree to do that. So practical help here means you're able to lend your ears, be there with them. If they need food, you give them food. If they need water, you give them water. Or just be silent, sitting silently with them. That would be, that's the least thing that we can actually do. So that's the abbreviation for elaboration for the abbreviation SAVE. Okay, now I'm moving on to, I'm going to go a little bit quicker here. So I'm going to go a little bit more detailed on how to help, right, people who are going through crisis, trauma, and grief. And this is how you actually assess risk and ways to handle it. All right. So if, again, the question would be, how do we assess risk if a person is in danger or not? So based on your conversation with that person, say, let's say you're talking to someone, you're talking to a friend, and then how do I know whether, this is a crisis, whether we need immediate, she or he needs immediate help or not? Okay, you ask, okay, based on your conversation, ask yourself, based on your conversation with him or her, do you believe there is an imminent danger? So there are three categories of scenarios here that could happen. So one, yes, imminent danger is clearly present. Second one, in the middle, you're not sure. It means it's unclear whether the person is in imminent danger or not, or whether the danger is present. Okay, and no, imminent danger is not clearly present or clearly not present. Okay, so how do we know if the person is in imminent danger or clearly in danger? The person talks about suicide. Okay, that is the first warning signs. Talks about suicide. Okay, I'm going to go a little bit further later on in details. What kind of, how do we know by just talking about suicide the person would commit? Okay, talks about suicide, talks about feeling trapped and burdened to others, feelings of extreme hopelessness, guilt, and shame, as you mentioned in the chat box, getting the means to take your own life. It means they are actually looking for something to actually assist them or help them or aid them in actually committing suicide. So they try to stock pills, or they try to get anything that is sharp, for example, to put near them. Okay, withdrawing and saying goodbye from family and friends or community. Some people would leave a will, all right, or would write suicidal notes, for example. Okay, giving away prized possession is also very common. There's something that we really, really love, or we really, we are very much, it's something precious for us, but we actually give them away to other people. That is also one of the signs. And then acting erratically. Now, this is actually very important. Acting erratically here means people from a very calm, collected, or very, how to say, patient, or anything, any changes in the character that is so profound or significant, that shows that the person is not well. Okay, so they can be in a very manic state, for example, or they're doing something that they're not used to do, or something that they're used to do. Okay, a type of behavior. So, for example, posting something that that is so off, for example. Okay, so or putting a WhatsApp status that sounds really, it's not familiar, for that person to do that. Okay, and of course had attempted suicide before. So if the person has attempted suicide before, there's a high possibility that the person would attempt again. Now, also, if there are family members who actually committed or attempted to commit suicide, the higher the chance the person would actually commit as well. So it runs also in the family. Okay, and okay, that's the part where imminent danger is clearly present. The second part, you're not really sure. So this person would say, okay, I have engaged in self-injurious behavior, okay, or self-injury, which means cutting or burning, and now admits that they might be engaging in that behavior in the future as well. So they have had history. Okay, he or she makes statements that are suggestive. Again, I'm highlighting the word, or emphasizing the word suggestive here. Suggestive of suicidal thinking, but you're not really sure, because sometimes the words can mean something else to you. All right, so that is where you need to clarify. So that is why we need to conduct what is called suicide inquiry. Okay, so I'm gonna come back to this slide later on, but I'm gonna go to suicide inquiry infographic. So suicide inquiry is actually this. Okay, this is also an adapted version, from assessment 5-step evaluation and triage. Okay, so Suicide inquiry starts with ideation. Ideation means thinking or ideas or thoughts. So these are the examples of questions that you can ask for people or to people who are actually going through certain emotional roller coaster or emotional crisis or anything like that. Okay, or going through traumatic experience. So specifically, if they mention something about suicide. Okay, so how frequent have you been having these thoughts? So it needs to be very, very specific. Frequency here means how frequent, how many times have they thought about it during the day, during the night? So is it every single hour? How many times in a week or how many times in a day you would have those thoughts? That's number one. Frequency. Intensity, how strong are the thoughts and feelings of wanting to commit? How strong they feel in their heart that actually they want to commit or they want to end their life. Okay. And number three, duration. So how long have you been having these thoughts? Is it within a month, within last 2 weeks, within a year, or anything like that? Okay, so it's basically again asking the right questions so you can get the right access. Okay, so these are ideation. The second one, plan. So plan becomes much, much more specific because whatever that whatever ideas or thoughts they have in their head, they might actually do it. So planning is part of it. So timing, location, access to means, and preparatory acts. So example of questions that you can ask is when. When exactly do you plan to commit suicide? I know these questions are really, really straightforward and really direct, but you can actually paraphrase. Yeah, you can actually paraphrase these words. You can use your own words, but make sure that you highlight the main points there. The frequency, the intensity, duration, and now the timing. When exactly do they plan? Because these are the details that you need to jot down or write down. And these are the important information that you should have in order to intervene. Okay, so when exactly do they want to commit? Is it day or night, tomorrow, today, or anything like that? Where is the location that they would like to do it? There are very, very famous like places or spaces that people would go to, yeah, to commit suicide. So location is important as well. In their house, in a building or anything like that. So the location is important. Access to means how available are those things with them. Okay, so is the I'm saying are the means or the equipment or the tools that they want to use, is it with them, or is it available all the time, and how would they prepare for it? Do you have any access to any weapons, right? So that those are the questions that you can ask. And intent, extent to which the person believes that the plan and the act will be lethal or self-injurious. Or it also means how what's the word? How are they sure? How are they sure in terms of the planning to be successful? So you can ask this question and you can give them a scale. From the scale of 1 to 10, how sure are you or how certain are you in actually thinking that your plan to commit suicide is going to be successful? So if it's more than 5, then definitely that is a red flag. Okay, so that is suicidal ideation. I know I'm aware of the time. I have 4 minutes, inshallah. Hopefully I get to finish what I was saying. Okay. So yes, so this is suicide inquiry infographic. Now, if ideation, plan, and intent are all present, return to the imminent danger. Again, it's ideation, plan, and intent. If all are present, go back to the imminent danger is clearly present. Okay, but okay, if there's no imminent danger or there's no imminent danger that is present or clearly not present, he or she reported that they are sad, anxious, overwhelmed, but did not express suicidal thoughts, or they're showing no warning signs. Okay, so that does not mean that we just leave them like that. There are ways to actually help them as well, even though they did not share any suicidal thoughts or ideation, and that's not necessarily warning signs. So let's go to how to help them. Okay, for imminent danger, of course, immediately call emergency services or any 24-hour crisis hotline. And there are things that you can jot down. Okay, write down any relevant details or information about the background of that person, and then make sure that you keep it confidential. You only give it to the person who is in charge. So usually we'll give it to the person, to the nurse or to the doctor that will be attending to the client or to the patient. And then for unsure, okay, if not all are present, just now I said, if all are present, go back to immediately calling emergency services and 24-hour crisis hotline. That is what you need to do. But if not all are present, if there is only ideation, there's no plan, there's no intent, then there is a higher possibility that this person would not commit suicide. So, but you don't just leave them like that. So discuss with him or her about your concern if help is not provided immediately, because there's a possibility of them relapsing in terms of injuring themselves. Okay, ask if they have seen a counselor or therapist before, if they have encouraged them to continue therapy. If not, you can actually provide services, a number of hotlines or any counseling services for them to get help from. Okay, so that is why you need to provide available resources. Continue to follow up with him or her if appropriate. Okay, I'm going to finish in a bit. Okay, so the last one, listen and provide for those who are not really clearly not in danger. You can listen, don't just abandon them. Listen and provide support, but do not become his or her therapist, because that is not your job. Okay, like I said, yes, anyone can be a helper, but not necessarily professional. So try to keep an open door policy. It means you can always come to me. Whenever you want to talk about something, you can always come to see me and talk about it. Okay. Even though I did not get to finish reading my slides, but it's okay. Perhaps I'm going to cover it in our next session. Thank you very much, everyone.